You know, hyperbaric oxygen therapy is this incredible treatment that can do amazing things, like heal stubborn wounds and even reverse radiation damage. But what happens when this powerful healing tool could actually be a danger? Today, we're digging into who should absolutely steer clear of HBOT and why for some, it's a definite no-go.
So let's just do a super quick refresh on what we're even talking about here. With HBOT, you're basically breathing 100% pure oxygen inside a pressurized room or tube. This simple process just floods your blood and all your tissues with way more oxygen than you could ever get just by breathing air. And that extra oxygen, it can be a total game changer for things like deep infections or injuries from radiation. But it also makes you wonder, right? With all that pressure, with all that oxygen, who is this therapy not safe for?
Okay, let's get right to the most critical piece of safety info. When it comes to HBOT, there's one condition that is an absolute, non-negotiable hard stop.
Yep, just one.
And this is it, an untreated collapsed lung, also known as a pneumothorax. The reason why is actually pretty simple, but really serious. The pressure changes inside that chamber can take the trapped air in the chest and turn it into a full-blown, life-threatening emergency called a tension pneumothorax. So this has to be completely resolved before a patient even thinks about HBOT.
Okay, so that's the one hard no. Now we get into a much longer, much more nuanced list of what are called relative contraindications. Think of these not as stop signs, but more like big, flashing yellow lights that mean proceed with caution. So if you see something on this list that applies to you, it doesn't mean HBOT is off the table. Not at all. It just means you and your medical team need to have a really thorough conversation to weigh the potential benefits against any potential risks.
Let's talk about meds. You'd be surprised how some medications can have pretty serious interactions inside the hyperbaric chamber. For example, a few chemotherapy drugs can wrap up toxicity in the heart or lungs when you add pressure and oxygen. This is a perfect example of why the hyperbaric team needs to know every single thing you're taking.
And this one probably won't surprise you. If you've got any kind of pre-existing lung condition, that's a huge point of discussion. Anything that might cause air to get trapped, like with COPD or asthma, creates a risk for what's called pulmonary barotrauma. And that's basically just an injury to the lungs caused by those shifts in pressure. Okay, but what about stuff that's already inside your body, like a pacemaker or maybe a pain pump? Well, most modern devices are actually built to handle the pressure just fine, but you can't just assume. The golden rule here is to always confirm the device's specific pressure limits directly with the company that made it before you start treatment.
And believe it or not, the caution list keeps going. A really high fever or a history of epilepsy can actually lower the seizure threshold in that oxygen-rich environment. Claustrophobia can be a huge psychological hurdle. And even something that seems minor, like having trouble clearing your ears, has to be managed so you don't injure your eardrums.
So if we just boil this whole section down to one key message, it's this: transparency is everything. The HBOT specialists have to know your complete medical history, every pill, every procedure, every diagnosis, to make sure the therapy is safe and effective for you.
All right, let's pivot and talk about the elephant in the room. The big one, the connection, or really the lack thereof, between HBOT and cancer. This is a topic that causes a lot of anxiety, so let's clear the air with what the science actually tells us.
And you can totally see where the fear comes from, right? It just sounds logical. Our bodies need oxygen to live. Cancer cells are our cells, so if you pump a ton of extra oxygen into a body that has a tumor, it feels like you must be feeding the cancer, just making it grow faster. But here's the twist. The science shows us that the reality is the complete and total opposite of that fear. The common thinking is that more oxygen equals more tumor growth. The scientific reality? It's a lack of oxygen, a state we call hypoxia, that actually drives tumors to become more aggressive.
I know. That sounds completely backwards. How in the world could starving a tumor of oxygen actually make it stronger? Well, it all comes down to how incredibly and terrifyingly adaptive cancer cells are. Let's start with this key concept: tumor hypoxia. This is what happens when a tumor grows so fast that its own blood supply can't keep up. Parts of the tumor literally get starved of oxygen, and that creates these really dangerous little hypoxic pockets.
And this is where things get really wild. In response to that low oxygen, the tumor cells flip into survival mode. They start pumping out signals to grow new, chaotic blood vessels. They switch their entire metabolism so they don't even need oxygen. And these very adaptations are what make the cancer more aggressive, more likely to spread, and, crucially, more resistant to treatments like chemo and radiation.
And that is exactly where HBOT comes in and flips the entire script. By flooding the body with oxygen, it directly fights that dangerous tumor hypoxia. It gets oxygen back into those starved areas, which in turn helps the body shut down the very proteins that are screaming at the tumor to grow and spread. So it doesn't feed the tumor, it fundamentally disrupts its survival strategy.
All right, let's zoom out and put all these pieces together. We've hit the one absolute deal breaker, we've gone through the long caution list, and we've busted a huge myth. So what's the final takeaway here?
Here's what you really need to remember. First, the only absolute red line is an untreated collapsed lung. Got it? Second, you have to be an open book with your medical team about your entire health history. And third, and this is a big one, the fear that HBOT fuels cancer is a myth. In reality, it's the lack of oxygen that helps tumors thrive.
And you don't just have to take my word for it. The research from StatPearls puts it perfectly. They say the risk of HBOT promoting cancer is largely theoretical, while the benefits it can offer, especially to patients recovering from cancer treatments, almost always outweigh that tiny theoretical risk.
So, at the end of the day, it all comes down to this. Your safety isn't just one person's job. It's a team effort. It's a partnership between you, your primary doctor who knows you best, and the hyperbaric specialists who know this therapy inside and out.
So I'll leave you with this thought. Now that one of the biggest, most persistent fears about this therapy has been busted wide open, what other healing doors could this incredible tool safely open for us in the future?